Alright guys, we're here again today. We want to talk or continue our discussion on the gastrointestinal tract growth anatomy. The last topic we treated before is the stomach. We did extensively discussing the stomach, the curvatures of the stomach, the sphincters of the stomach, the cardiac sphincter, as well as the pyloric sphincter. We looked at the curvatures of the stomach, the greater curvature and the lesser curvature, and parts of the stomach, which include the fundus, the cardia, the body of the stomach, the pyloric antrium, as well as the pylorus. These are structures or areas of the stomach that are important anatomically. We also did the atrial supply of the stomach. The major atrial supply of the stomach is coming from the celiac trunk. And I told you, students, you must understand that the celiac trunk has three important branches. These branches are the splenic artery, the left gastric artery, as well as the hepatic artery, which is the main hepatic artery or the common hepatic artery. These are the branches of the celiac trunk. And you will have all these different branches that branch from these arteries. Now today we want to continue that. We'll be looking at the duodenum today. Take note of that. The duodenum, the ileum, or the jejunum, and then the ileum. So we're looking at the small intestine. So let's continue. The first part of the small intestine is the duodenum. Now the duodenum is about 25 centimeters long. It's a C-shaped structure that looks like that, covering the head of the pancreas. Now it's important that you should know, as gross anatomy student or anatomy student, you should visualize in your mind's eye these structure as they lie deep to the anterior abdominal wall. So when you put your knife on any person, abdomen, anterior abdominal wall, you exactly know structures that lie deep to the area that you put in your knife. This is one of the things why surgeons are very great people. So let's continue. The duodenum. So we're going to be looking at some, let's start with, we're going to give out an outline of the vertebrae. Okay, we'll give an outline of the vertebrae because our center of attraction is going to be the vertebrae. Okay, so that's the vertebrae. So we have, that's your T12, that's your L1, your L2 vertebrae, L3 vertebrae, that's L4, and that's your L5. So that's your thoracic vertebrae, lumbar vertebrae, all the way from 1 to 5 lumbar vertebrae. Now we want to take this as our center of attraction. So we're going to be bringing out all the structures of the abdominal organs or viscera that are in relation to the vertebral column, and pay attention to that, the vertebral bones, okay, how they are related to other organs. So this is very important. So let's label this as our T12, that's your L1, that's your L2, L3, L4, and L5. I hope you understand this. Between them we have your disc, right? So make no mistake about that. Those are your discs. Okay? Good. Now we understand that. This is very clear. Now the duodenum. The duodenum is a C-shaped structure. It's the largest in diameter of the other parts of the intestine. It's about 25 centimeters in length if we are to stretch it out. So it has 4 parts, which we'll be looking at now. So let us have this. Let's bring out the outline of our duodenum. So the duodenum extends from the level of L1, that's the diameter of the duodenum. So it extends all the way down, going passing 3 and 4, right? And you have that as your duodenum, okay? And then it curves, that's your duodenum, all right? So this C-shaped structure from here, all right? Remember that your pylorus is somewhere here. If I am to extend this, that's your pylorus, okay? And that's your stomach, okay? It's lesser curvature of the stomach, and we can have that going on there. Now, and including T12, it's important that I have to include T12 for something very important. That is the arch of aorta as it exits from the thoracic region into the abdominal region, passing through the diaphragm. So the aorta, which is the hiatus, exit from the thoracic cavity into the duodenum, passing through the duodenum into the abdomen at the level of T12. So we're going to include right there our arch of aorta as it descends downward, because it's going to be an important landmark. So let us put there so this is your arch of aorta. So that's your arch of aorta. Descending all the way down. So that's the arch of aorta descending all the way down. Okay? That's your arch of aorta. So I'm going to take this off. Alright? Alright? So that's your arch of aorta. So I can give it some color to help you discern that. And this, of course, is going to be your diaphragm. Okay, so that's your diaphragm. Okay, so that's your arch of aorta, and this is the duodenum, which is about 25 centimeters in length. Now remember that this L1 is our transpyloric plane. So that's your transpyloric plane. Always remember that's your transpyloric plane, and that is where you have the pyloric region of the stomach. Now the duodenum has 4 parts. 4 parts of the duodenum. Let's look at the 4 parts of the duodenum. So this is going to be, we're going to label this as A, and this is B, this is C, this is D, and of course this is E. So those are the parts of the duodenum. Now this portion here, A, B, is the superior part of the duodenum. So that's the superior part of the duodenum. Okay? Now the superior part of the duodenum is approximately 5 centimeters in length. Alright? The superior part of the duodenum is 5 centimeters in length. Now C represents your descending part of the duodenum. That's the descending part of the duodenum. It's approximately 7 to 10 centimeters in length. Then D, which is this portion here, you either call it the inferior part of the duodenum, or you can call it the horizontal part of the duodenum. That's the horizontal part of the duodenum. And I hope we're all following this clearly. I'm going to take it step after one after the other so that you understand these basic stuff. Okay? So this is usually 6 to 8 centimeters in length. Alright? And then E is the ascending part of the duodenum. The ascending part of the duodenum, which is also 5 centimeters in length. Now, having known this, it's important that you all know this, have it somewhere at the tip of your finger, okay? Now, the superior part of the duodenum is covered by peritoneum. The superior part of the duodenum is covered by peritoneum. It's covered by mesentery, okay? Now, it's interesting to note that the first 2 centimeters of the superior part of the duodenum is mobile, very mobile, because it has mesentery. So this first 2 centimeters is mobile because it is covered with mesentery. So you know, mesentery are double layer of peritoneum that extends from the posterior abdominal wall all the way to the viscera. It encloses the viscera, so there is this mobility of that viscera because it is attached to something that is extended from the back all the way to the front. You know what mesentery does? Mesentery actually take alongside with it neurovascular structures to viscera. So this portion of the first 2 centimeters is covered by peritoneum and it is mobile. So this first 2 centimeters of the duodenum is intraperitoneal. It is usually called the duodenal cap. So we're going to represent the duodenal cap right there. So that's the duodenal cap, or it can also be called the ampulla. So that's the duodenal cap right there. Okay? Now on the other 3 centimeters of the duodenum is immobile, which means it is not movable. It is retroperitoneal. So this first 2 centimeters, the first 2 centimeters is intraperitoneal, and the second 2 centimeters is retroperitoneal. I hope we understand that clearly. All right, good. Now how about the descending part, the inferior or horizontal part? All these are immovable. They are immovable, and they have they are retroperitoneal. Retroperitoneal. They are retroperitoneal. Okay? Now, having seen this, we want to look at structures that are related to the different parts of the duodenum. We want to look at structures that are related. I'm going to go through this a little bit faster, and I want you to jot this down because I have a small board here. It cannot take all this information. Now, let's take these structures. Remember that your gallbladder is up there. So let's see. We have the pancreas. So I'm going to use a green structure, a green stuff. No, let me not use the green stuff because I already use the green there. So let me use a black stuff. But remember, your pancreas is not black, but I'm going to use this. So that's your pancreas. Okay? That's the pancreas. extending all the way there. That's the pancreas. Okay. That's the uncinate process of the pancreas. Okay. So I'm gonna kind of take this off because the pancreas is covering the whole of this. So let me take this off a little bit. Alright? Good. That's your pancreas. Now we have also, let's see that we have the other structure that we're going to have here is the gallbladder, as well as, remember, right here you have your hepatoduodenal ligament. I'm going to ask my student this question. The hepatoduodenal ligament is conveying what structure? Tell me. Right, good. It is conveying the portal triad. So we're going to have the portal triad right there. And on the portal triad, it consists of, we have veins, which is the hepatic portal vein. So we have your hepatic portal vein up there going upward. Okay, that's the hepatic portal vein. And then we have artery, which is the hepatic artery. You have artery as well. That's your artery driving upward. Okay, and then you have the bile duct. That's the bile duct. So the common bile duct, and then you're going to have the common bile duct, and then the cystic duct, and that's the gallbladder. Covering the whole of this is the hepatoduodenal ligament. So the hepatoduodenal ligament covers the whole of that. Okay, so that's the gallbladder, that's the common bile duct. Behind it there is your hepatic portal vein, and that's the hepatic artery. The hepatic artery, okay? Good. Now this, remember that the hepatic artery is actually branching off from the common hepatic artery, which is a direct branch of your celiac trunk. And the celiac trunk is somewhere here. Remember that the celiac trunk branches at the level of T12. So this is our celiac trunk. That's your celiac trunk, which gives a left gastric artery, and then it gives, that's your splenic artery, and here you have your hepatic artery, the common hepatic artery, and then common hepatic artery gives the proper hepatic artery, okay, which is going upward, and then you also have other branches coming from the proper hepatic artery, which is the right gastric artery, that anastomoses with the left gastric artery. Now here you have your lesser curvature of your stomach, okay? And then you have the gastroduodenal artery that's going to supply the stomach. But we want to look at, we're looking at the duodenum. So pay attention to that. So the other thing we want to look at here, we're talking about the superior part of the duodenum. So now you see the structures that are related to the superior part of the duodenum. Just from this conversation, you can see the structures that are related to it. Okay? Good. Now we're going to take the following. This is the guideline. Here is the guideline. The guideline are, we're going to take the superior part of the duodenum. We'll look at structures that are anterior, that are related to it anteriorly, structures that are related to it posteriorly, okay? Structures that are related to it medially, medial part of it, and then superior, and then inferior, and then the vertebral level. What level of vertebra is it? So these are what we'll be looking at. So we're going to take the superior part of the duodenum. We will analyze which structures are anterior to it, posterior to it, medial to it, superior to it, inferior to it, as well as the vertebral level. And that's what we're going to do right now. Now, it is becoming very clear that these are the structures. Look at the structure, it's very clear. It's not difficult to find out. As long as you just put the C-shaped structure, put the head of the pancreas there, that's the body, and that's the tail over there, you're good to go. And then also remember, superior there, you also have what? The portal triad. So you already have begin to start bringing out structures that are related to these different parts of the duodenum. Now, let's take the superior part, which is about 5 centimeters long, extending from A to B. Okay? Now the superior part is almost horizontal, but it is superior. Now structures that are anterior to it, look at that. Structures that are anterior, take note of that, to the superior part of the duodenum will be your gallbladder. The peritoneum, of course, that's the peritoneum. Okay? And the liver is that right there. You see? The liver is right there. So the gallbladder, which is there because the gallbladder is falling over there, the quadrant lobe of the liver, which is there, and the peritoneum. So 4 structures are anterior to the superior part of the duodenum. Let's take that again. 3 structures, I mean to say, the peritoneum, right, the gallbladder, as well as the quadrant lobe of the liver. Now, what about posterior to the superior part of it? The posterior structures would be the gastroduodenal artery, the hepatic portal vein, the hepatic artery. You can see them. It's not difficult because anatomy is easy. It's what you can see. You have to see it. It's what you can see, what you can feel, and should be able to describe. That is gross anatomy for you. Alright? So, posterior structures are the gastroduodenal artery, the hepatic portal vein, and hepatic portal artery, as well as the inferior vena cava. The inferior vena cava is on the right side of the arch of aorta. Okay? Now we go medially. What are the structures that's found medial to there? That's the pylorus. Because see, I just showed you there because that's the pylorus. Okay? Superiorly, it's going to be the neck of the gallbladder. And then inferiorly is going to be what? The head of the pancreas. And how about the vertebral level? L1. And remember, that was why I drew the vertebral column initially. So L1, that's L1, it's at the level of L1. How about the descending part? The descending part is 7 to 10 centimeters. That's the descending part of the duodenum. Now the descending part is very interesting because there are a lot of things in the descending part which we're going to talk about later on. Anteriorly, what are the structures that are found in the anterior aspect of the descending part of the duodenum? Okay? Those structures would most likely be the transverse mesocolon and of course the transverse colon. So those are the structures that are found in the anterior aspect. What about the posterior aspect? The posterior aspect, because look at that. Remember that the kidney is there at the posterior aspect there. So you're going to find the hilum of the right kidney right there. You're also going to find the renal vessels. You're also going to find the ureter. Okay? And again, you're going to find the psoas major. Yes, psoas major. What is the psoas major? Remember, when we did lower limb, we talked about the psoas major, which is a muscle that is found in the anterior aspect of the thigh that extends all the way from T12 up there and inserts passing between the inguinal ligament and the pelvic bone to insert inferiorly to the lesser trochanter of the femur. That's the psoas major, alright? So it helps in causing flexion of the thigh, okay? Flexion of the thigh at the level of the hip joint. So that muscle runs all the way passing through that region. Medially, what do you find medially? Medially, you're going to find the head of the pancreas. Superiorly is the superior part of the duodenum. Inferiorly is the inferior part of the duodenum. And of course, at the vertebral level, it's going to be L2, L3. Simple. Now we move over very quickly to the D part, which is the inferior or horizontal part of the duodenum. So what do we find there? Now listen to me very carefully. Now you're going to have structures that are exiting. So the superior mesentery artery branches from the arch of aorta at the level of L1. So it branches from the level of L1, descends passing through the insulinate process, okay, and then exits from there. That's the inferior, that's the superior with its branches. That's the superior mesentery artery with its branches. And we have right there behind it is the superior mesentery vein, which is accompanying that. And that forms part of your portal system. So you have it right there. Okay? Now the horizontal part, which is this portion here, the horizontal part is about 6 to 8 centimeters in length. Okay? What are the structures that are found in the anterior aspect of the horizontal part would be what? Your superior vena, your superior mesentery artery, and as well as your inferior mesentery artery, and the intestine around that region. Okay? What do you find posterior to that? You find the IVC. So we have the IVC here. So this is the IVC. That's the IVC. On the right side of here, you find the IVC. Okay? It's ascending upward. You find the IVC and as well as the arch of aorta. And of course, on this side, you find the right psoas major as well as the ureter, the right ureter, posterior to that. Okay? How about medially? You don't find anything in the medial aspect because it's just an extension of that. And then superiorly, you find the insulinate process of the pancreas. Inferiorly, you would have, of course, the same structure. And of course, the vertebral level is going to be L3. Okay? Now, the ascending part, look at the ascending part. Okay? The ascending part, that's the ascending part. The ascending part, structures that are found in the anterior aspect of the ascending part. Okay? The structures that are found in the anterior aspect of the ascending part would definitely be the intestine, because you have the intestine around there, and you would also have the peritoneum, and structure like the ligament here. There's a ligament here, okay, called the Tres ligament. Ligament of Tres. So that's the Tres or ligament of Tres, which is a skeletal muscle that helps in causing deflection around there. Okay. You also have structures that are found in the posterior aspect of that. You have the psoas major as well. There's also a structure that are found there, and medially, this would be the medial, would be the margin of your, arch of aorta as well as inferior vena cava. And inferiorly, you have the intestine around there as well, and the vertebral column, where you find that the level of vertebral column would be vertebral column 3, which is the L3. Okay, so this helps us to understand the different parts of the duodenum, and I hope you get that clearly. Okay, now let us try to, okay, what we're going to do right now is to explain the ducts that are found at the level of the inferior or the horizontal part? The descending part, right? The doctor found in the descending part, okay? So let's remember that you have a pancreatic duct. That's a pancreatic duct that extends all the way there. And then goes into this portion here, okay? All right, good. And then this extends all the way down from, okay, I want you all to pay attention to this. This is very interesting. So this descends all the way down. It's coming all the way down. It's coming all the way down. And then unite with this. Okay? And then we have an accessory pancreatic duct that extend all the way down there. So you see, this is draining the pancreas, okay, and emptying into the descending part of the duodenum, okay. Now let's see this. This is your pancreatic duct. That's the pancreatic duct. That's the pancreatic duct. Okay. Now this is the minor duodenal papilla. Okay. That's the minor duodenal papilla. This is your major duodenal papilla. Okay. Now remember, this is your common. That's your common bile duct. Your common bile duct unites with the pancreatic duct, and so this portion here becomes the hepatopancreatic. Okay, we can call it the hepatopancreatic duct, or you can call it the hepatopancreatic ampulla. So right here, it becomes the hepatopancreatic ampulla. This is the hepatopancreatic ampulla. Now the ampulla looks like a cap, a small cap, which is this. So extending from here, there is a bulge, like a sinus, that extends all the way from the free margin of the pancreatic duct all the way to the major pancreatic ampulla. So right inside there's a sphincter, okay, and that sphincter is called the hepatopancreatic sphincter of OD. Hepatopancreatic sphincter of OD. Alright? Now this can be also referred to as the hepatopancreatic ampulla of Vater. V-A-T-E-R. Now let's take this again. That's the pancreatic duct. It's important we understand the basic anatomy of this. That's the pancreatic duct. The pancreatic duct extends all the way down here where you have it to be a free margin, and then there's a bulge that looks like a sinus right there. That's the ampulla or the cap before it drains into the duodenum. Alright, that's the opening of the hepatopancreatic ampulla or the hepatopancreatic duct. That's the opening. That opening is described as a duodenal papilla. Alright? This bulge from the free edge all the way down to the papilla is called an ampulla. It's called the ampulla of Vater or hepatopancreatic ampulla of Vater. inside there is a sphincter that controls the emptying or the release of pancreatic juice. Okay, that is described as a sphincter of OD. So it's right inside there, just like you have the cardiac sphincter and the pyloric sphincter that controls these openings. Now we have an accessory, that's an accessory pancreatic duct. Okay, that's an accessory pancreatic duct. And this is the gallbladder draining its content via the common bile duct, because remember, it's still going to bifurcate into a left and right bile duct. Okay, now these are very important structures that you should know in anatomy, in gross anatomy, knowing the relationship of the different parts of the duodenum, structures that are found anterior, posterior, medial, superior, inferior, and the level of the vertebral body that these structures are found. Similarly, you should know the relationship of the C shape of the duodenum and the head of the pancreas. Okay? Now, these structures here are important for you to note. Okay? They're very important for you to know. This flexure here is called the duodenal jejunal flexure. So it marks the origin of the beginning of the root of mesentery. That was why I said that the anterior aspect of the ascending part of the duodenum is covered by intestine. However, the portion of the intestine actually is the root of mesentery that is covering there. We will talk about the root of mesentery in the next video. Thank you very much for your time.